So I like to keep it, maybe I'll go through 12 minutes of 10 minutes or so of slides of what we're all about, talk to you a little bit about my story a little bit more in depth, and then, go into just conversational Q&A if that works for, for everyone. So let me go ahead and share this screen and do a quick screen check. You can see this, correct? Okay, very good, very good. All right, so as I mentioned, I am the founder and CEO of NuLife Virtual. We are a community healthcare platform that utilizes the same addictive power of social media to change how we treat addictions. Throughout the building of this platform and through our journey, we've been recognized by several organizations for some of the work that we are, doing and working on. And a lot of it just comes from experience, both as, in technology from my perspective, then getting sober, then opening brick and mortar treatment centers, and then realizing what wasn't working. And so, I'll touch on some of that journey. Some of the numbers and statistics I'm sure that everybody is unfortunately aware of, but I always like to bring them to light. Over 100,000 people died, in the past 12 months in the United States alone from drug overdose. And, it's one human life every 5 minutes. And the interesting thing about this is when I first started building this deck over a year and a half ago, as it's evolved with what we've been doing as a company, this number was about half of this. It was about one every 10 minutes or so. And now it's one every 5 minutes with the new statistics. So if that tells you anything, I know in 1 year we had a 30% jump, and I think we haven't really scratched the surface and what we're going to see with, kind of the tsunami of things. I mentioned, having young kids and just the effect, and just these graduations brought a lot to light to see these kids share, their experiences, strength and hope, and kind of going through this period and what they've overcome. So, really a lot of this is for them and to kind of help create a better tomorrow. Outside of the pandemic, it is the #1 leading cause of accidental death in America. So it's, very, very, pertinent statistic that we need to pay attention to. But the fact is that the, people dying is not the only problems. It's a symptom. It does get all the headlines. And, as we see here, 1 in 3 households are affected. It costs the U.S. economy, over 1 trillion, annual when we talk about, the criminal justice system based on drugs and alcohol, healthcare systems. 58% of people that go to treatment don't keep treatment. And statistics are all over the place. It's very hard to quantify some of these, but it's a big number. We have caregiver burnout, I think even more than ever. Compassion fatigue. I saw this frontline when I worked as, in treatment, because you would just see people come in and out through a revolving door. I mean, we would see people 18 to 20 times in a resident. Those were extreme cases, but there was too many of those cases. And so you get fatigued with compassion when people continue to come back. And it's because the system doesn't work. We treat it as an acute care problem, and it's really a chronic disease. And your area more than I know your area, but I know that I'm here in LA, and we have AA, NA, and support groups and meetings and treatment centers. You can throw a rock and you get to one. But when you get outside of these major metropolitan areas and rural areas, the problem is only exacerbated. Access to care and quality care, or peer support, or even the wanting to reach out to people because everybody in town and you don't want people to know your secret is a very difficult problem. And it's so amazing to do this work and to offer up a digital platform where people can more easily reach out. And as you see here from some of the stats, the drug use is up among 8th graders and actually all youth. 50% of teenagers have misused. I don't have the statistic on this page, but I'm sure you've heard it recently that, adolescent suicides are also up, I think, to, record numbers. It's a very personal problem to me because I almost died. The current treatment model didn't work, for me. Again, that's why I opened up treatment centers in 2014, realized what worked and what didn't, and set out to solve the problem. While I wasn't someone that was destitute or homeless or housing insecure. I was somebody who, when I drank, which alcohol was my thing, it didn't work for me, and good things didn't happen when I drank. And it took me a long time to realize and to build the community and to figure out, what was working and what wasn't. And when I owned treatment centers, what I realized is I would see people come into care, into treatment, and develop these amazing relationships because they were going through such a powerful change in their life. But when they left, there was no way to maintain those relationships, or if they lived in another town or they went somewhere, they weren't able to maintain that community. And we weren't able to easily bring their parents, or not parent, their support systems. I dealt with adults, support systems. It could be family members, it could be friends, into the process, which is so important, because sometimes, number one, they need help themselves. Number two, they could be the triggers, or number three, they could be the reason for the problem, to begin with. So it's very personal to me, which is what makes it so much more rewarding that we get to help deliver care. So what we do, and essentially what NuLife is NuLife is an app and a platform. And what I like to say is we allow brick and mortars to become more patient centric, click and mortar. So we're not here advocating that digital health or online treatment only can replace in-person health. We're advocating that there needs to be a hybrid model. Not everybody needs in-person treatment. Not everybody needs inpatient treatment all of the time, and not and some people can do well and find care in just a pure remote setting. But that's not really what's taught in physical treatment centers and in finding care for substance use. We've all been taught to anybody calls up, if someone doesn't want to come into physical treatment, they're in denial, and sometimes that's where they're not ready to completely dismantle their entire life. Maybe they work and there's no way for them to not work. Maybe they have families, maybe they go to school. And so digital treatment is a substantial opportunity for existing providers and treatment centers to see more people, to reduce the friction and improve access to care, which is a huge part of our problem. And what we also see as you look at this continuum on this graphic is what NuLife does is it allows, whether I'm a healthcare system, I'm a primary care physician, or I'm an independent practitioner, I can provide digital care. I can refer people into NuLife, into a community where they can find people, peers to connect with, and they can also locate treatment resources and treatment providers that they can engage with based on those treatment centers' actual outcomes and success rates. So our initial beachhead of what we do is work with, and I'll cover that down the line. But what we want to do is we want to connect all the areas where people fall through the cracks, in our opinion. When I would see people, there's a significant continuity gap between inpatient and outpatient care where we lose a lot of patients. Someone comes into an inpatient program, and I asked this woman last week, I was talking with her, and I said, so you went to inpatient treatment, and she was in Ohio. I said, you went into inpatient treatment. I said, did you go to outpatient treatment? She said, no. I go, were you able to stay sober and in recovery? She said, no, not initially. I said, well, why didn't you go to outpatient treatment or continue some type of care? And she said, well, because when we finished, they just handed us really a slip of paper and said, you should go and attend these or call these people and continue, that care. So there was no continuity of, hey, you're leaving here, but tomorrow you're going to enroll and you're going to attend this group, or you're going to go to this meeting, or you're going to meet with this practitioner or this, counselor, because it's easy. And I say that term loosely, relatively easy comparatively to go into a residential type of program and not drink or use for that period of time. A lot of times people go in, they're drying out, they get good food, they get somewhere to sleep, they get people surrounding them, telling them how they can do it and how great they are. And those things are all very true. But then what happens is they walk out those doors and they have to go back to where they were, right? Which a lot of times is where the problem, began. And so having somewhere that they can continue, and it's not always, accessible or reality to have them continue with a schedule to go to a physical outpatient center. But if they can be in this app with their existing provider or connected to someone that is then going to provide their care and immediately continue those next steps, we have a lot less of an opportunity to lose those people. So we'd like to say we bridge those gaps between clinical care, peer coaching, and ongoing support groups, and create a straight and transparent path from referral through treatment and back into life for life, because they have to be connected when you're in life. I'm 10 years in recovery, okay, 10 plus years. And I still go to meetings and I still need support. It's different type of support than I needed when I was 30 days or 10 days or 60 days, but it's still support. And if I didn't have that support, I don't know if I'd still be on this path, and drinking's not my problem anymore, but a lot of times it's my mental state and my mental health. I'll pick up the pace a little bit. So our platform is a SaaS platform enabling existing providers, as I said, to digitize and deliver services, collect outcome data, build communities and scales. So patients and their support systems get to integrate that care with their lives, social support, and community. So we allow treatment providers to actually digitize what they do, become more efficient and effective, and engage with their patients, even have automated engagements with their patients utilizing our technology, and collect valuable clinical assessment data and behavioral data along the way so that they can adjust treatment plans, engagement and outcomes all along that way. And it's simply because we want to make recovery much easier. And it's very hard, so we want them to do it once. We've had a lot of, we've had success with our current, we're a startup. We have 10 treatment centers utilizing our platform, and that's starting to grow rapidly. And the reason is because we allow them to keep and stay connected with their patients to stay connected with other patients, their patients to find peer support, and for them to be able to measure clinical outcomes all along the way, which is what it's really all about, is keeping people connected and making sure that we measure how are they doing all along this continuity of care. And in the future, insurance providers, private insurance providers, Center for, Medicare, they're really going to want to know, is this facility, is this provider, are they doing a good job? And that's the information we want to be able to provide to our clients, so that they can provide that data not only to their clients and families, but to the insurance companies. So in a nutshell, we enable providers to blend treatment programs and personalize, and then allow them to personalize on-demand content, communities, and support groups between their sessions as well, because it's constantly, I may need something at 12 at night or 2 in the morning, and it's not while I'm in session. We want to keep them engaged outside of their sessions, so they always have people to talk to. We always have valuable content for them to read, to listen to, and to review. And we want to provide the insights into their home life to the provider, which is why we use a lot of clinical assessments and communication on our platform. So treating patients will become more like retail consumers going forward. 59% of consumers want their in real life experience to match their online experience. And so our philosophy is that treatment providers now, whether I'm an individual psychologist, psychiatrist, counselor, or a hospital or a clinic or a treatment facility, they need to be able to provide virtual services and care at all times and on demand to their patients. And that's what we help them do. And so we allow them to lower their client acquisition costs, because unfortunately, I think the statistic is 50 to 60% of people re-enter treatment within 1 year of completing treatment. So if they stay connected, Hopefully, our goal is to go upstream and catch them before it becomes too far. I've seen it firsthand. Just recently, a friend of mine, he goes in and out, in and out, in and out. And if you don't catch him in the first 5 days, I mean, he's gone. He's gone for months and maybe longer. If you catch him in the first 5 days, you might be able to correct the ship. And that's really what we're all about. So the patient and practitioner is someone that's the rock star in this care, and we like to put them front line. And understanding that patients, want to be able to engage directly, but there has to be boundaries, and general social media does not provide those boundaries for people to stay connected, in a private, HIPAA compliant, connected way that allows the practitioner and the patient to have a relationship that also has boundaries. So we also help them uncover unknown needs, employ self-reporting to understand better what their patients are doing long-term, and so that they can make changes along the way in care. And look, this is a business, a lot of this as well. So I can talk from the healthcare system and government all the way down to the individual person. The more that we keep them engaged along the way, and provide them an easy way to stay connected, the lower cost it is going to take care of that patient long term. And that engagement drives outcomes, and it drives satisfaction. And then we like to say that we give our patients the ability to stay connected. As Jacob here, quite said, listen, when I leave treatment, I feel lost. And with NuLife, I was able to stay connected. I was able to be confident when I started the next chapter of my recovery pathway, and essentially answer the question, who am I going to hang out with tomorrow? How do I stay away from old friends? A lot of times people, when they go into this, they come out, they can't go back to any of their old friends. Maybe they can't even go back to any of their family or support system. And so a community of like-minded people in the palm of their hands is a safe and secure way for them to realize that there is, another way of life. Just a few, I'll buzz through this one, but just gives you a little shot of, we ask questions. Why are you here? How are you feeling? Recommend, different assessments. Assessments can be pushed out by practitioners, treatment centers, providers. And then we can suggest treatment centers and treatment providers that will best fit someone's, what somebody is looking for. Now, it's important to say right now, our original beachhead is to go to a treatment, a healthcare system, hospital or treatment provider, and have them set up and invite all of their patients, and have them the ability to engage them in community, to engage them in taking assessments and clinical services. Our next step as we build that supply channel will then be making more intelligent recommendations. I can go into that more later, but I wanted to be very clear what we can do today, and what we're looking to do going forward. We like to add direct value, and I kind of already said this, to treatment centers, individual practitioners, the patients, and their support systems. And we do this by allowing treatment providers to increase access for patients and family members who are remote, who are uninsured. We talked about stigma, right? Stigma and access is one of the biggest determinants or deterrents from people getting care. I don't want my neighbor to know. I can't leave my job. Maybe I don't even want my spouse to know. And so being able to do it in a secure, safe, mobile or, online way is that entry point. We're not saying that they don't need physical care, physical in person at some point, but that entry point, that toe in the water, that's the hardest step, that first step. And we hope that they can achieve better results because we're going to give the clinicians data about that person. What do they need? How are they feeling? How are their assessments looking? And instead of those clinicians who are typically not data scientists, I don't know if you know clinicians, they're typically not data scientists. We're going to point out, hey, out of your 50 clients or out of your 25 or out of your 100, these 5 right now have triggered an alert based on how they've answered their most recent assessments, you need to figure out and pay some attention to them as quickly as you can, versus going through all of the data and trying to sort out who needs your help most at that point.
All
and
right,
when patient,
since we have barely 5 minutes left.
oh shoot, I lost track of time. I'm so sorry.
I can tell, and I was losing track of time because this is all so fantastic. So I'd love to open it up. Since
yeah, absolutely.
Very healthcare focused folks on this call, open it up to questions. And you have a very encouraging comment in the chat by Jared, but please, for anybody who has questions for JD, please unmute and ask away.
Did you want me to read an answer, or did you want me to?
Let's see if we have anything live. Carol?
Yeah, if I may. I've got kind of a startup background too. So, so where are you with regards to getting some anchor treatment centers? Because it sounds like this is really, really important to have that core to develop a peer network, et cetera. It's a snowball thing.
It is a snowball thing. Yeah, so we worked 1.5 years from the beginning of November. We worked 1.5 years with a big anchor client, Colorado, establishing this, launching our MVP, and then launching our latest version to them. And it's a huge success. Their outpatient program grew and grew and grew. They had almost like a 65 to 80% conversion from inpatient to outpatient conversion, which is crazy. That's an insane number. Like normally, I mean, if I had a 25% people that went, when I left physical treatment, I stayed with treatment, immediately. And we have, since we've released our latest version about 8 weeks ago, we've signed up four programs in the US, 2 new ones in South Africa, 1 in the UK. And like I said, that's our initial beachhead. Like we're looking to work with any and every provider right now, whether it's a pilot or, a program to get them set up to build that supply. You're exactly right.
And so how much of your algorithms do you have established right now? And how much are you having to kind of test and manipulate as you move forward to get those notifications and that peer network and all?
Yeah, great question. I mean, we have the foundation for collecting all the data to get really intelligent algorithms and things going forward. Notifications and assessments, for example, all of that is ready. Like, for example, if we triggered it, let's just say a PHQ-9 assessment, right? Or a general anxiety disorder assessment, that's all ready right now. I could trigger it, send it out to you. You take the 10 or 12 questions. I don't know how many are on that particular one. You get this back. You can see, hey, this person scored a 20, and we put a red there. You need to. Those are ready right now. As far as building recommendation engines and things going forward, that's going to need us to collect a lot more data. Both our plan is to collect the self-reporting assessment data, but also the behavioral data, like how are you interacting with other people, behavioral data, are you going to meetings, are you making all your sessions, and then are you getting better? So putting that data is, it's a longer tail kind of approach.
All right, well, we've run out of time very quickly. It's already 1:30 or close to 1:30. Eric is asking if you have all the stats and information in a fact sheet. And JD, if you don't mind adding your email address in the chat, then everyone can have that too to follow up with additional questions, and especially if there are folks that will watch the recording at a later date. Thank you very much for.
Yeah, I'm so sorry I got long-winded. I lost track of time.
I can do that, and it was worth every minute.
Yeah, I appreciate it.
And JD, one of the questions that I think is often asked is, what do you need now?
What I need now is I would love introductions to individual practitioners or clinics or treatment providers, to meet with them, to walk them through the platform, and then to just see, is this something that they would like to pilot and launch. That's our number one thing, that we're all about getting people on the platform and making sure that this works.